Heart attack symptoms, causes, and treatment. Heart attacks, also called myocardial infarctions, are very common in the United States. In fact, one happens every 40 seconds. Trusted source, according to the Centers for Disease Control and Prevention. Chest pain is the most common warning sign of a heart attack. But there can be other symptoms, too, like lightheadedness, nausea, and shortness of breath. Symptoms can be severe or mild, and are often different from one person to the next. Some people may not even notice any warning signs of a heart attack. When heart attack occurs? A heart attack happens when blood flow to the heart is blocked or cut off. If there's not sufficient oxygen-rich blood flowing to the heart, it can cause damage to the affected area. As a result, the heart muscle begins to die. When your heart isn't getting the blood and oxygen it needs to function properly, it can put you at a higher risk of heart failure and other serious complications. A heart attack is a life-threatening medical emergency. The sooner you can get medical treatment that restores normal blood flow to your heart, the better your chance of a successful outcome. Heart attack symptoms. General symptoms for a heart attack can include chest pain or discomfort, shortness of breath, pain in your arm, shoulder, or neck, nausea, sweating, lightheadedness or dizziness, fatigue, upper body pain, trouble breathing. Anyone experiencing any of the above heart attack symptoms should contact emergency services immediately. Heart attack causes. The leading cause of heart attacks is coronary heart disease. This is where plaque builds up in the arteries that supply blood to the heart. The general buildup of plaque in the arteries is also known as atherosclerosis. There are two main types of heart attack. Type 1 heart attacks are where plaque on the inner wall of the artery ruptures and releases cholesterol and other substances into the bloodstream. This can then form a blood clot and block the artery. In type 2 heart attacks, the heart does not receive as much oxygen-rich blood as it needs, but there is not a complete blockage of an artery. Other causes of heart attacks include torn blood vessels, blood vessel spasms, drug misuse, hypoxia, lack of oxygen in the blood. Heart attack risk factors. Several factors can put you at risk for a heart attack. You can't change some factors, such as age and family history. However, you can make changes related to modifiable risk factors. Modifiable risk factors that you can help control include smoking, high cholesterol, obesity, lack of exercise, high levels of stress, diabetes or prediabetes, eating a diet high in trans fats and saturated fats, excessive alcohol consumption, sleep apnea. Heart disease is the leading cause of death among most ethnic and racial groups in the United States and the most common cause of heart attacks. How is a heart attack diagnosed? Doctors typically diagnose a heart attack after they perform a physical exam and review your medical history. Your doctor will likely conduct an electrocardiogram (ECG) to check your heart's electrical activity. An echocardiogram, which uses sound waves to create an image of the heart's chambers and valves, can reveal how blood is flowing through the heart and what parts of the heart, if any, have been damaged. Your doctor may also order a cardiac catheterization. This is a probe inserted into the blood vessels through a flexible tube called a catheter. It allows your doctor to view areas in and around your heart where plaque may have built up. They can also inject dye into your arteries, order an X-ray to see how the blood flows, and view any blockages. Your healthcare team will likely also take a sample of your blood or perform other tests to see if there is evidence of heart muscle damage. A commonly used blood test checks for levels of troponin T, a protein found in the heart muscle. Elevated levels of troponin T in the bloodstream is associated with a heart attack. Treatments. If you've had a heart attack, your doctor may recommend a procedure, surgery or non-surgical. These procedures can relieve pain and help prevent another heart attack from occurring. Common procedures include stent, A stent is a wire mesh tube surgeons insert into the artery to keep it open after angioplasty. Angioplasty. An angioplasty opens the blocked artery by using a balloon or by removing the plaque buildup. It's important to note that healthcare professionals rarely use angioplasty alone anymore. Heart bypass surgery. In bypass surgery, your doctor reroutes the blood around the blockage. Heart valve surgery. In valve repair or replacement surgery, surgeons repair or replace leaky valves to help the heart pump. Pacemaker. A pacemaker is a device implanted beneath the skin. It can help your heart maintain a normal rhythm. Heart transplant. Surgeons may recommend a heart transplant in cases where a heart attack causes permanent tissue death to most of the heart. Your doctor may also prescribe medications to treat your heart attack, including aspirin, other drugs to break up clots, antiplatelet and anticoagulants, also known as blood thinners, pain relievers, nitroglycerin, blood pressure medication, beta blockers. The timing of getting treatment is crucial with a heart attack. The sooner you get treatment after having a heart attack, the more quickly blood flow can be restored to the affected part of your heart, and the more successful the outcome is likely to be. Heart attack prevention. While there are many risk factors that you cannot control, there are some basic steps you can take to help keep your heart healthy. Here are few examples. Eat a healthy, balanced diet. Try to incorporate nutrient-rich foods in your diet as often as possible. Focus on lean proteins, whole grains, fruit, vegetables, low-fat dairy, nuts, and seeds. Try to limit fatty, fried foods and foods that contain simple sugars like sodas, baked goods, and white bread. Exercise regularly. Try to get at least 150 minutes trusted source of physical activity a week for optimum heart health. Quit smoking. If you smoke, consider talking with your doctor about starting a smoking cessation program. Quitting smoking can help reduce your risk because smoking is a major cause of heart disease. Limit your alcohol intake. Moderation is key when it comes to alcohol and heart health. Light to moderate alcohol consumption is defined as 1 drink per day for women and 2 drinks per day for men. Get your cholesterol levels checked. If your LDL cholesterol or triglycerides are higher than they should be, talk with your doctor about what you need to do to lower your cholesterol and triglycerides. Manage diabetes. If you have diabetes, take your medications as your doctor prescribed and check your blood glucose levels regularly. Work with your doctor. If you have a heart condition, work closely with your doctor and follow your treatment plan, which includes taking your medications. All of these steps are important in lowering your risk of developing heart disease and potentially having a heart attack. Talk with your doctor if you have concerns about your risk of a heart attack. At the end, it is requested you to please subscribe our channel.